is a diagnosis at that stage helpful? One of my surgical colleagues has asked me to ask you, will a diagnosis help him at this stage in his life?
Absolutely. So one thing to say is that it's very, very likely that the reason, or part of the reason that they are where they are is also because of ADHD.
Yeah, so it is a superpower.
Yeah. So as I mentioned, there are things like hyperfocus that people with ADHD often exhibit. Also, you'll find that people with ADHD have a remarkable sense of creativity. So the ADHD brain can sometimes make connections between things that other people won't.
Yes.
Because of the way their brains work, they'll join two dots that other people won't see as being able to be joined. So that allows them to potentially become entrepreneurs. Allows them to solve problems in new and novel ways. Combining that with a increased appetite for risk. The drawback with that is if there is a set of tasks that is daunting or overwhelming and maybe monotonous, like having to study for an exam, that might be where the ADHD brain might struggle. If you're not interested in something, you're allowed to just not want to do a certain thing. So ADHD would be something that kind of prevails over several domains of your life, rather than, if I don't like studying for exams as a standalone thing, that doesn't indicate necessarily ADHD. It could be, but as a standalone doesn't mean it. But if it is ADHD and there's something that can help your colleague to focus, it may well be worth exploring a diagnosis.
So you as a psychiatrist, first and foremost, how do you make that diagnosis?
Okay, so there are a number of tools that we use. Questionnaires, there's something called a QB test that measures, it's about a 20 to 30 minute test that with a webcam that people can do at home. And they have a series of shapes is put onto the screen, and the shapes come in different shapes and different colours.
Right.
When the shape and the colour both match on the screen, they have to hit the space bar.
Okay.
Sounds straightforward enough, but it's a very agonising test for a lot of people.
Okay.
And what happens is that the webcam monitors, using facial recognition technology, monitors how much attention you're paying and how much head movement you have. How often you hit the space bar in the right way and how long it takes you is also measured.
Okay.
As well as how often you hit the space bar where nothing's happening and you just hit it because of kind of an impulsivity to do so.
Yeah.
And so it's not a diagnostic test, but it will give you a likelihood of having ADHD type symptoms.
Sure.
And then combining that with things like a DIVA, which is a kind of semi-structured interview, and then SNAP 4 questionnaires that they give to school, to parents, which then allows you to kind of get a sense of where is this child or where is this person struggling. As an adult, you might find that it's at work and at home, or and so when you have all that information, and then you interview the patient, or you interview the patient with the parents if they're a child, then you can collate all of that and you can see whether they meet the diagnostic criteria for ADHD.